Antidepressants are psychoactive substances that alter the brain in such a way that it gives the impression of relieving symptoms. To this day, it is not known what causes depression, and the theory that depression is caused by a chemical imbalance in the brain has remained a theory that has never been proven. The latest scientific research says that psychotropic drugs are psychoactive substances that change the functioning of the brain. It is not known what causes depression or other mental illnesses, such as schizophrenia. Antidepressants do not fix chemical imbalance in the brain, but rather change the brain in ways that affect emotions, personality, and how the body functions as a whole. Long-term use of antidepressants can cause withdrawal symptoms, sexual dysfunction, emotional blunting, weight gain, and addiction. In some people, long-term use of antidepressants can increase depression and lead to a state of chronic depression. You may ask why I am talking about it, since I'm not a doctor or a scientist. Yes, it's true. I'm not a scientist or a doctor, but as a journalist with fluent English, I have access to the latest scientific research, and a very important article came out a few months ago, which, in my opinion, did not get much attention. It was an article published in the prestigious journal Science in July 2022, and it collected and analyzed everything we know so far about what are the causes of mental illness, such as depression or schizophrenia, and how psychotropic drugs used in treatment of these diseases actually work. Conclusions I found in this article were so amazing, and the whole story of where antidepressants came from is so fascinating that I decided to tell you about it. I will only present facts based on scientific research that I found and which you will find under the video. I'm not recommending anything. I'm not saying stop taking your meds. I will just say what is the latest research, what is the latest knowledge about the effects of long-term use of antidepressants. I'll give you the facts, and you decide what you want to do with them. But as I said, the story is fascinating, and it starts with the fuel used by the Germans for Messerschmitt fighter aircrafts, through a hospital in New York where tuberculosis patients were being treated, all the way to a doctor's office where medication is being prescribed. So let's go back to World War II, when Germany began to run out of fuel for planes. And scientists started to look for new substances that could be used in mixtures for fueling fighter aircrafts. And they found a substance that had been discovered almost 100 years earlier, also in Germany. The substance was called hydrazine, and there was a large supply of it left after the end of the war. It turned out that this is a very toxic substance, and such very toxic substances were of great interest to doctors and scientists, because you could try to use the toxic properties of these substances to direct them against various bacteria, viruses, or other factors known to cause disease. So you could make medicine out of them. And indeed, it turned out that one of the medicines that was made on the basis of this substance was effective in the treatment of tuberculosis. So a drug was created, and it was taken to a hospital with a very beautiful name, Seaview Hospital in New York, where people suffering from tuberculosis were treated. And they were given this medicine, and indeed, it turned out that TB patients began to recover. But that was not the strangest thing that happened. The most amazing thing was that the patients in this hospital jumped out of beds, left the rooms, went outside the hospital, started dancing and clapping. Some journalists were present on the scene. They took pictures of TB patients dancing and clapping hands. And in 1953, the Associated Press Agency published a photograph showing dancing TB patients with caption, "Yesterday, the silence in this hospital was broken only by the sounds of coughing. Today, the patients were dancing the halls, though they had holes in their lungs, having undergone an astonishing transformation from morbid depression to euphoria." What was the extraordinary phenomenon of this drug, which, apart from curing tuberculosis, albeit with many side effects, which prevented it from being used shortly after, but scientists wanted to know, what is the secret? What is the magical effect that leads to the fact that patients who are very sick and sad in their illness suddenly become cheerful and happy and want to dance? They started to use the drug in people diagnosed with depression, and it turned out to work. That is, it turned out that people who were suffering from depression, after taking this TB medication, no longer had symptoms of depression. And this is where the concept of an antidepressant was created, and the drug itself was called an antidepressant. Even though that medication did not cure depression, it only worked in such a way that it relieved symptoms to such an extent that the depressed person did not exhibit the behavior characteristic of someone with depression. So that was the beginning. But in the meantime, another drug was created, which was a derivative of chlorpromazine, which had been derived from synthetic dyes used to dye fabrics. And the first antipsychotic drug for schizophrenia was made from chlorpromazine. And one of the chlorpromazine derivatives turned out to be effective also for people with depression. And this is how tricyclic antidepressants were created. They were derivatives of the phenothiazines used to make antipsychotics. The drugs were obviously working. However, nobody knew why or what was the mechanism of action of those drugs and how exactly they work to reduce symptoms of depression in people taking them. And to shorten the story a bit, and without going into too much detail, scientists studying the brain discovered the existence of neurotransmitters, which are substances sent between nerve cells to create a certain effects. For example, some neurotransmitters are stimulating, some other have a calming effect. They found and studied various neurotransmitters in the brain, such as serotonin, dopamine, epinephrine, and norepinephrine. The scientists were also studying people with depression in different ways, including collecting samples of the cerebrospinal fluid. And they found out that people with depression had less serotonin in their cerebrospinal fluid, and people who died as a result of suicide, most likely caused by depression, had less serotonin in the brain in comparison with people who died, for example, as a result of car accidents. But the most remarkable thing about all of this is how the conclusion was drawn about what causes depression. Because usually, when we have a drug that works for a disease, first we know what causes the disease. For example, Mycobacterium tuberculosis causes tuberculosis, so we develop a drug that will destroy the Mycobacterium, and this is how we treat the disease. Or, for example, if we know that the cause of cystitis is bacteria of a certain type, we use an antibiotic that is effective specifically against that strain of bacteria. With antidepressants, it was completely different. So we have a drug that reduces the symptoms of depression. We don't know how it works. We have people who died by suicide. They have less serotonin in their brains than people who died of natural causes or in car accidents. And now we draw the following conclusion. If there is less serotonin in the brains of people with depression, then depression is caused by a lack of serotonin in the brain. This is how the theory was created. It wasn't that we studied the brain well enough, or that we understood the way neurotransmitters in the brain work well enough and performed experiments so advanced that we could say beyond a reasonable doubt what causes depression. To this day, it is not known what is the cause of depression. And in those studies in the 50s and the 60s, the devices used to study the brain were quite limited, not as advanced as they are today. And why is it important? Because it was decided that if there is less serotonin in the brains of people who died of suicide, and in the spinal fluid of people suffering from depression, it most likely means that depression is caused by a lack of serotonin in the brain. I don't know if you can see, but for me, there is a bit of a lack of logic here. Because it seems to me that the correct conclusion that could have been drawn from this particular situation might sound like this. Depressed people have less serotonin in their cerebrospinal fluid. And that is a conclusion that could have been drawn because we do not know what caused the depression or what caused this possible lack of serotonin in these people. The more so because today's research, the scientists were trying to prove whether it's true that people suffering from depression have less serotonin in the brain. And it turned out that they do not. These studies were repeated many times. In some studies, it turned out that people with depression actually do have less serotonin in the brain. Other studies have shown that depressed people have more serotonin in their brains, and other studies have shown that depressed people have as much serotonin in their brains as other people. This is how the chemical imbalance theory was developed, saying that depression is caused by a lack of serotonin. And the search for drugs began, because the drug that I mentioned, the tricyclic antidepressants, relieved the symptoms of depression by blocking or affecting all the neurotransmitters and had a lot of very unpleasant, very severe side effects such as hypertension, heart palpitations, dry mouth, and many others. So someone came up with the idea that if we already know, although in my opinion, it doesn't make sense. It wasn't logical, the conclusion that was drawn. But it was felt that if we had the hypothesis that the cause of depression was not enough serotonin in the brain, then we could create a drug that wouldn't alter all the neurotransmitters in the brain. It will only target one specific neurotransmitter. It will only target serotonin. And this is how the so-called SSRIs, or selective serotonin reuptake inhibitors, were created. The first one was called Prozac. It appeared on the market in 1988. Not only did it appear on the market, but it appeared on the cover of Newsweek as an announcement of a total revolution in the treatment of mental illness. Because before that, mental illnesses were treated by methods considered scientific, but resembling more of torture, such as treating the sick by pouring ice water over them until they almost drowned, because it was believed that not only would cold water help them, but also being mortally terrified. Or, for example, lobotomy was used, which involved drilling holes at random in the front part of the brain, which severed the connections between the front part of the brain and the rest of the brain. The creator of the lobotomy won the Nobel Prize in 1949, even though later it turned out that lobotomy has many side effects and its results are completely accidental because it was impossible to precisely make those holes in the brain. I will tell you about the lobotomy some other time because it's another fascinating story. The sister of President Kennedy, after her lobotomy, stopped talking, stopped walking, and just sat in her room staring at the wall and spent the rest of her life in a private clinic hidden from the world. So the advent of fluoxetine, the first antidepressant that blocked, I have to explain first what serotonin is and how it works, and how the serotonin reuptake inhibitors work. So serotonin is a neurotransmitter, a chemical that is sent between nerve cells in order to produce an effect. So we have one nerve cell and another nerve cell, or neurons. They do not touch each other, but there is space between them called a synapse. And now, this cell sends serotonin molecules that jump across the synaptic space. They reach the other cell, which has receptors that accept serotonin. This cell takes in serotonin and takes in as much as its receptors allow, which is a certain amount, and rejects the rest of it. Some of the rejected serotonin is broken down in the synaptic space, and some of the serotonin goes back to the original cell and is stored in it for the next use. And now, scientists came up with this idea that the easiest way would be if we block serotonin in the space between cells. So, under the influence of the selective serotonin reuptake inhibitors, what happens? This cell sends serotonin to the other cell. Serotonin jumps through the space and reaches the other cell. The cell takes as much serotonin as it wants to and discards the rest. Some of the serotonin gets broken down, but here's where the reuptake inhibitor comes in. So serotonin is not being returned to the original cell for further use. It's just staying here in this space, which is increasing its amount in the brain. And scientists have adopted a very simplistic way of thinking that if there is not enough serotonin in the brain, we will force the brain to have more serotonin in it, and this will definitely improve the mood of a depressed person. And since they assumed that depression is caused by a chemical imbalance in the brain, this is how they could fix the chemical imbalance and depression will be cured. But it is not. The reason is the brain is very flexible, neuroplastic, and is always adapting to new circumstances. So, if there is more serotonin in the brain due to the drug, the brain responds because from the point of view of the brain, which is always trying to maintain homeostasis. Homeostasis is a state of total balance. And the most important thing is that we cannot bring the body into the state of homeostasis because this is an internally controlled state. Only the body is able to create and maintain homeostasis. We can help in various ways by taking some action. So the brain is trying to maintain the state of homeostasis, also as regards the amount of serotonin. If there is too much serotonin, because it is artificially retained in the intercellular space, meaning the synaptic space, the brain responds by reducing the number of receptors in the receiving cell. It means that if we force the brain to have more serotonin that it would naturally have, the brain responds by reducing the number of receptors, which are becoming fewer and fewer, in order to balance the unnaturally high amount of serotonin caused by the drug. What does it mean in the long term? Let me add that antidepressants were not studied long term when they were introduced, because at that time they were thought to be the magic drug that could completely change the paradigm of mental illness. Earlier, it was believed that mental illnesses were diseases of the soul, heart, mind, related to the environment in which a person was brought up, etc. But now we don't have to worry about it, because from now on we are going to treat depression the same way we treat hypertension or diabetes or any other disease, which means that it's a purely physiological disease caused by a malfunction of the body, in this case, a malfunction of the brain. So all we need to do is create a pill, and all you need to do, dear patient, is to take the pill and you will be cured of depression. And although it sounded great, and short-time studies showed that indeed people suffering from depression under the influence of the drug did not have symptoms of depression, it was not at all a proof that antidepressants were curing anything. It was just a proof that they reduced the symptoms of depression. At that time, it was considered the greatest invention of science of the 20th century that would solve the problems we had before, because earlier in the 18th and 19th centuries, psychiatric hospitals were overcrowded with mentally ill people who were treated like beasts, shackled, starved, and treated with other equally inhumane methods. Nobody knew how to deal with this problem. So the arrival of a pill that was supposed to treat depression seemed like a remarkable achievement indeed. But like I said, these drugs were not being tested long-term, and the short-term effects of the drug indeed proved effective to relieve the symptoms of depression. So, in the 20th century, when Prozac came along, and then the next SSRIs, everybody went crazy about them. The consumption of these drugs increased 3 to 4 times in the following years, and they're still prescribed today, although already in the late 80s, there were first voices disagreeing with the serotonin and chemical imbalance theory. And there were scientists who wrote about it, such as David Healy, who wrote about the fact that there is no scientific proof of a chemical imbalance in the brain in depression. and there is no scientifically confirmed guess as to what causes depression. And only now, many years later, when we have long-term studies and when the techniques of studying what is happening in the brain and throughout the body are more advanced, and now we know that antidepressants or SSRIs such as Prozac do not treat depression, but rather they are psychoactive substances. Psychoactive substances such as, for example, alcohol. So if you use the same logic of thinking, you could say that if I feel very anxious before interacting with people, I'm afraid to talk to people, I'm not sociable, I withdraw, I don't have self-confidence, I don't have courage. But after drinking alcohol, suddenly I'm brave, I make spontaneous decisions, I'm very sociable, I have no problem approaching a stranger and starting a conversation. Then, using the same logic, you could say that alcohol cures lack of self-confidence. But obviously, this is not true. So, antidepressants and other psychoactive drugs work exactly the same way, meaning they work in such a way that they do not treat the source of the disease, but cause changes in the brain. Or you could say, as suggests Professor Joanna Moncrieff, who is the author of the study that I mentioned before, the article published in the journal Science in mid-2022, which examines everything we know about depression, serotonin, and the theory that mental illness is caused by a chemical imbalance in the brain. And she says that it is not true that antidepressants fix abnormal brain conditions, but on the opposite. Antidepressants create an abnormal state of the brain, which makes us feel differently. That is, they change emotions, they change personality. I have read studies that suggest, for example, that long-term use of antidepressants reduces empathy, reduces the ability to feel compassion for other people. So, antidepressants are psychoactive substances that change emotions, change personality, cause emotional indifference, especially when used long-term, which means that with long-term use, you stop being yourself in a way, and you are not able to rationally assess what is happening in your life, how you feel, and how you can change it. It's a bit like giving opium to someone who is in pain. Opium has an analgesic effect, but opium is also a psychoactive substance. And people who were given opium said they still felt some pain, but they just didn't care about it anymore. They stopped paying attention to it. It didn't bother them anymore. So you could say that we are prescribed antidepressants so that we don't feel suffering. However, anyone who has ever experienced suffering in life knows that this is through suffering that we do learn how to find and feel joy. And today, during long-term studies, we learn how antidepressants affect the brain and whether they cause any permanent changes in it. And it has been confirmed that indeed they do cause long-term changes, which provoke the withdrawal symptoms if we stop taking them. Withdrawal symptoms are very similar to addiction, except that in addiction, there is an additional factor of striving to achieve pleasure when I use the substance I'm addicted to. And in the case of antidepressants, there is no question of any pleasure, because the effect of antidepressants is rather unpleasant and does not give euphoria, but rather relieves symptoms, introducing a state of emotional indifference. Even if the emotions and feelings are still there, I feel indifferent about them. I don't care anymore. So we know now that most people who try to stop taking antidepressants experience very unpleasant withdrawal symptoms. They can range from headaches, insomnia, severe depression, to anxiety, suicidal thoughts, and more. In addition, it is already known that long-term use of antidepressants causes emotional numbness, causes various sexual dysfunctions, causes weight gain, and in many people also causes addiction. And the way we talk about and understand the source of depression is very important, not only as regards medicine, but also in life. Because if you go to a doctor and you're depressed, and the doctor tells you it's a chemical imbalance in your brain, he's telling you that your brain is damaged, that there's something wrong with your brain. And if you take the pill will fix this dysfunction. It will fix your damaged brain. But it kind of suggests that you're helpless in the face of the fact that your brain is somehow broken and there's nothing you can do about it. So it kind of takes away from you the responsibility for your own life. Apart from that, it may create a risk of a possible addiction and possibly experiencing various prolonged side effects of antidepressants. It also takes away your responsibility for yourself. In a way, it takes away the hope. Because if the doctor said, we don't know what causes depression, it could be environmental causes, air pollution, sometimes genetic causes, although now it's known to be true to a very small extent. It could be childhood experiences. It could be suppressed anger. It could be various toxic substances found in water, in the air, in food. It can be a specific experience. It can be the loss of the loved one, the loss of a job, a difficult financial situation, the lack of friends. So we don't know what causes depression. I can give you a medication to ease your symptoms. And then we can start looking for the cause. And we can try to think about how we can change the way you think about who you are, what's around you, and the way you approach life's problems. And then the message you get is quite different and says, here you are, this is the medication that will help you temporarily not feel these symptoms. And at the same time, it encourages you to use all your humanity to grow as a human being and recover from depression. Because, as I said before, it is now known beyond any doubt that antidepressants do not cure depression. Because we don't know what causes depression. And we know that depression is not caused by a chemical imbalance in the brain. So antidepressants not only don't cure, but they can also cause a variety of very unpleasant side effects, including withdrawal symptoms, which means that even if you want to stop taking them, it may be dangerous to your health and life, and it may turn out to be very difficult. You would have to reduce the dose very gradually and skillfully for many months so that the brain can get used to it. Let me also immediately add that I am not against antidepressants, and in this article, and not only in this one, but in many articles that criticize the theory of chemical imbalance in the brain, it is not about giving up antidepressants at all, because they can make a lot of sense and can be a real lifesaver for someone who is very lost and not able to reach and understand their emotions, having their normal brain function blocked. To unblock normal functioning of the brain, taking antidepressants in a certain amount for a short period of time can be very helpful and can be a lifesaver. But persuading anyone to take antidepressants long-term may not make depression symptoms go away, but on the contrary, it may make it grow. So it's kind of a mystery why depression is still said to be caused by a chemical imbalance in the brain. The more so that many scientists and many psychiatrists have been saying for a long time, for several decades, that there is no scientific evidence that would confirm this theory. And I remember that the director of the Psychopharmacology Committee of the FDA, Food and Drug Administration, which is the office that decides which drugs will be approved for use and allowed the use of Prozac and other SSRIs, antidepressants, he said that it's true. We have no evidence that depression is caused by a chemical imbalance in the brain, but we use it as a useful metaphor because if we say something like this to the patients, they will understand. And also, if we say something like this to the patients, and this is what I'm adding to the quote myself, the patient will be more motivated to take the medication. And that is, in a nutshell, the history of antidepressants. Surely you may have heard that before them, there were the famous benzodiazepines, such as Xanax, which were advertised as good for everyone. You could give them to your grandpa if he was in a bad mood, and to a screaming husband, and to misbehaving children, and to a housewife who was trying to run the whole house, frustrated at being locked at home with kids, and without a fair chance of having a meaningful job, because women did not have equal rights in the 50s and the 60s. So back then, benzodiazepines were prescribed left and right to anyone. And everyone was convinced that they are miraculous drugs that restore proper functioning, immediately remove stress, and put you in a good mood. And then it turned out that benzodiazepines are very addictive and cause a lot of very unpleasant side effects, especially when used long-term. So they change not only the brain, but the whole body. They produce a variety of symptoms, ranging from thinking problems, flu-like symptoms, suicidal thoughts, vomiting, headaches, irritability, lethargy, sexual dysfunction, learning disabilities, memory decline, insomnia, personality changes, aggression, and many, many more. So then the famous benzodiazepine scandal broke out, and back then they were still being referred to as sedatives, stimulants, or stress relievers. They were not said to be directed against any disease. When SSRIs were introduced, drugs such as Prozac and others, to cut off this unpleasant association with infamous benzodiazepines that had a different mechanism of action but caused similar symptoms of sedation, calmness, relaxation, muscle relaxation, They were no longer called relaxants or mood enhancers. But this is when people started talking about antidepressants, suggesting that these are drugs that do not only reduce symptoms or relieve symptoms, but that they are drugs that treat depression. One of the most remarkable recent discoveries about antidepressants is that they cause chronic depression when taken long-term. Most likely because they force the brain, because they artificially increase the amount of serotonin. The brain responds by reducing the number of serotonin receptors. So no matter how much serotonin there is in the brain, there are no receptors they can take it in. As a result, the symptoms of depression may get worse. And even a new term was coined, tardive dysphoria. Dysphoria is the opposite of euphoria. And just as euphoria is an experience of incredible joy, dysphoria is the inability to feel joy, the inability to feel positive emotions and joy. So, chronic depression is one of the symptoms of long-term use of antidepressants. So yes, the cause of depression is not known. It is known that there are things that can help, such as vitamin D or sunshine, but also vitamin D available as a supplement. It is known that movement, physical activity, sport can help. It is known that omega-3 fatty acids help. It is known that skillful therapy helps, especially cognitive behavioral therapy, which helps you understand the way you think, your instinctive reactions, and helps you change them. It is known that contact with other people helps. There is even a theory that the cause of depression is disconnection or lack of connection with the rest of the world, with other people, and with yourself. One of the biggest hurdles to having this connection with others is widespread access to social media, because sometimes people in the same room prefer to text each other rather than talk face to face. It is known that friendships, being part of a larger community with which we have a common goal, and where we feel important and needed, this is a very important factor in recovery from depression. It is also known that people who have life difficulties, such as financial difficulties, difficulties with work, with relationships with other people, and additional stress, are more prone to depression. People who have experienced some deep, painful loss. These are all life and environmental reasons. So now it is believed that depression must be understood as it was understood before, as a phenomenon at the same time related to biology, because everything that happens in the brain is related to what happens in the body and vice versa. So it's related to human biology, but also to the environment where you live, to the way you think about yourself, to your heart and to your mind. I hope this information will be useful. You can easily verify the truth of what I'm saying. The list of studies referenced in this video is below in the description. I wish you all the best.